Hi, Dr. Harrison here, and today I want to talk about the very important topic of auto injuries. We see patients suffering with injuries related to motor vehicle collisions in our office pretty much every day. Many times they'll have what we call whiplash, which is a sprain strain to the neck due to the impact of the vehicles. Many times the occupants get shaken in the car, so the patients we see are suffering with neck pain, headaches, back pain, sometimes even an injury to the shoulder from the shoulder strap. They might have tendonitis. They may have actually even torn tendons. So proper examination and diagnosis is very, very important. First thing we do is a very thorough history. We do a thorough exam. We're going to x-ray the areas that were injured and really determine what's going on with the patient, how severe are the injuries, and what we need to do to get them back on the road to health. Usually we have two goals in mind when we're treating these patients, or let's say three. The first one's obvious. We want to get the patient out of pain and feeling better. That kind of goes without saying. But more important, long-term, what are the long-term benefits of going through a chiropractic physical therapy rehabilitation program? Well, it's really twofold for me. And the things that I think are most important for my patients long-term. Number one, if we lose mobility in neck or back joints, spinal joints in general, or in a shoulder and a knee, wherever this injury is, anytime we lose mobility in a joint long-term, that begins the arthritic process. So over time, if we lose mobility in a joint, we're much more prone to developing arthritic change. And that's something that I think obviously is important for my patients. We want to prevent that from happening. So my job as the chiropractor is to get in there, make sure we get normal mobility back into the joints that were injured, whether it's the neck, the low back, the elbows, knees, wherever that may be. So that's very, very important, and what I think is probably the most important, getting that normal movement back. Number two, we want to minimize scar tissue formation. And if you ever knew somebody who had an old injury and they maybe are working out in the yard or they're doing daily activities and they're like, that old elbow injury of mine is acting up, or that knee injury of mine is acting up. Well, that's the scar tissue that's usually tugging and pulling in there and irritating the tissues around that joint and creating inflammation. So anything we can do to minimize scar tissue formation in the body is very, very important during that healing process. And after an auto accident, you really only have maybe 3 to 6 months at most to rehabilitate those muscles and ligaments and minimize that scar tissue formation. The way we minimize scar tissue formation is by doing the adjustments, muscle stim, ice, physical therapy, therapeutic exercises, stretching, resistance exercises, all help scar tissue heal more in alignment with the original tissues. So we can't prevent all the scar tissue from coming, but we can minimize the amount needed to repair those tears in the muscles and ligaments, which is what happens when we have a sprain strain. You've actually torn or pulled muscle and ligament fibers apart. And so as you heal, we want to make sure they heal in alignment and that there's as little as possible. So going through the physical therapy and the adjustments will help minimize that. Again, you only have that 90-day period, maybe 6 months at most, so it's very important to get in right after the accident. We want to make sure that you're not setting yourself up for this arthritic process down the road, but if you wait 3 to 4 months after the accident, most of the healing is already done at that point. Now all we can do is try to soften it up or undo some of what's been done negatively as that repair has happened. And I also like to mention to my patients, that it's more important the younger you are to rehabilitate these properly, because it takes 7 to 10 years before arthritis might show up on an x-ray. And what I mean by that is if you lose mobility in the neck or back and you have scar tissue there because you didn't get proper therapy, 7 to 10 years from now is when the arthritis might start to show up. So I always joke with my patients, if you're 90 years old, this probably doesn't matter too much because you're probably not going to be around in 7 to 10 years to enjoy the joys of the arthritis that are going to develop over that time frame. But in children, people in their 20s, 30s, 40s, 50s, people are living into their 80s and 90s now. Very important to rehabilitate these injuries properly so that you don't develop these arthritic processes and suffer needlessly with pain down the road. I see it all the time. People come into the office They say, oh, I just had this neck pain that came on kind of gradually. I'll take an x-ray, and same thing goes for low back. We'll take an x-ray and I'll see arthritis there that I can tell is maybe 15, 20 years old, and I'll say, what happened here? And the patient will think, oh, you know, I had an accident 15, 20 years ago. That's amazing that you guessed that time frame. And but it was minor pain, and I really didn't get it checked out, and the pain went away, and I didn't have any problem with it, but it just started bothering me a short time ago. Well, this is why it's so important to rehabilitate these. You lose that mobility due to restricted movement and scar tissue because it wasn't rehabbed properly, and 15 years later they show up in my office with neck pain or back pain and arthritis. I don't want this to happen to you. So very, very important to get checked out whether you have symptoms or not. And now in the state of Florida, they've passed a crazy law a few years ago that says if you don't report your injuries within 14 days of the date of your accident, that any complaint that you have is not covered. Well, you know, it used to be that you could have pain, you know, 6 months later, a year later, and if we could relate it back to the accident, it would be covered. And that makes total sense. What if you broke your leg and your leg was hurting so bad you didn't even notice that your neck was a little stiff or sore, you know, until you got the cast off the leg 6 weeks later? Well, guess what? Now those types of aches and pains won't be covered. So very, very important to get into the office within that 14-day period, get a complete examination so that we can make sure that you didn't injure neck, back, elbows, shoulders, whatever it is. Anything that is bothering you, even if it's minor, important to jot it down. If it goes away, great, no big deal. But if it lingers around, now you've got something that's going to be covered under your auto policy, and that's the way it should be. That's why you paid for the auto policy. You want to have those benefits available to take care of yourself if need be. So I hope this video has been helpful. I hope you found this information useful. If you've been in a recent auto accident, please call the office to get checked. Very, very important. If you're suffering with whiplash, neck pain, back pain, headaches, this is something we treat in the office all the time. Be happy to help you with that. If you're worried about legal representation, those types of things, we work with attorneys all the time. We know what types of documentation they like to have. And if you don't know a good attorney, we can always refer you to some. We've been in the area for 20 years. We know who the good ones are, who the bad ones are. Be happy to make a personal referral as a friend to you. So give the office a call, and I look forward to seeing you soon in the office.